Today, we're going to be talking about the opioid epidemic. So, what are opioids and why are we talking about them? Opioids are compounds resembling a narcotic substance called opium in addictive properties or physiological effects. The use of opium as an analgesic dates back to ancient civilizations of Assyria, Egypt, Greece, and Persia. In other words, opioids are as old as written civilization itself. Opium itself is a highly addictive non-synthetic narcotic substance that is extracted from the poppy plant Papaver somniferum. In the 19th century, the well-known medication morphine, which is used to help relieve moderate to severe pain, was first isolated from opium. Similar to morphine, other substances extracted from the poppy plant are called opiates. So, how do opioids help treat pain? Opioids help treat pain in mainly two different pathways. In the first pathway, opioids attach to proteins called opioid receptors on nerve cells and on other parts of the body. When this happens, the opioids block pain messages sent from the body throughout the spinal cord to the brain. Another pathway by which opioids help treat pain is by targeting the brain's reward system through flooding the circuit with dopamine, a type of neurotransmitter that plays a role in how we feel pleasure. So, what is the problem? Well, opioids also carry risk, and they can lead to addiction, overdose incidents, and deaths. They can even stop your breathing. When people first use a drug, they may perceive what seem to be positive effects. They may also believe that they can control their use. But drugs can quickly take over a person's life. Over time, if drug use continues, other pleasurable activities become less pleasurable, and the person has to take the drug to just feel normal. They have a hard time controlling their need to take drugs, even though it causes many problems for themselves and their loved ones. These are signs of addiction. Although the initial decision to take a drug is typically voluntary, with continued use, a person's ability to exert self-control can become seriously impaired. Brain imaging studies of people with addiction show physical damages in areas of the brain that are critical to judgment, decision-making, learning and memory, and behavior control. These PET scans compare the brain of an individual with a history of cocaine use disorder, which is shown in the middle and right, to the brain of an individual without a history of cocaine use, which is shown in the left. The person who has had a cocaine disorder has lower levels of D2 dopamine receptor, depicted in red, after 1 month and 4 months after stopping cocaine use compared to the non-user. The level of dopamine receptors in the brain of the cocaine user are higher at the 4-month mark, but have not returned to the levels observed in the non-user. As we can see, the use of an opioid like cocaine may lead to functional changes in the dopamine receptors of the brain. Prescription opioids used for extreme pain relief are generally safe when taken for a short time and as prescribed by a doctor, but they can be misused. So how do people misuse prescription opioids? People may misuse prescription opioids by taking the medicine in a way or dose other than prescribed, or by taking someone else's prescription medicine, or taking the medicine for the effect it causes to get high. According to the International Narcotics Board, the statistics from the US show that although the US contains 4.4% of the world's population, it consumes 30.2% of the world's opioids. A study comparing the consumption of oxycodone in the US versus Europe revealed that the consumption in the United States showed a dramatic increase starting in the late 1990s. Oxycodone is a prescribed narcotic that can treat moderate to severe pain. It is considered a high risk for addiction and dependence. Along with an increase in opioid consumption, there has been a massive increase in the number of overdose deaths. While in 1999 the total number of overdose deaths by opioids was 6,000, this number increased to 50,000 by the year 2016. So, how and why did this happen? In the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to opioid pain relievers, and healthcare providers began to prescribe them at much greater rates. From 1991 to 2010, the total number of opioid prescriptions dispensed by US retail pharmacies tripled. Increased prescription of opioid medications led to widespread misuse of both prescription and non-prescription opioids before it became clear that these medications could indeed be highly addictive. And in 2017, the US Department of Health and Human Services declared the opioid crisis a public health emergency. If we look at the opioid epidemic by numbers, in the United States, more than 130 people died every day from opioid overdoses. A total of 47,600 people died from overdosing on opioids. 10.2 million people misused opioids in 2018 alone, and 2 million people had an opioid disorder in 2018. So, why do some people become addicted to drugs while others don't? Biological factors that can affect a person's risk of addiction include their genes, stage of development, and even gender or ethnicity. Scientists estimate that genes, including the effects environmental factors have on a person's gene expression, called epigenetics, account for between 40 and 60% of a person's risk of addiction. In addition, environmental factors related to the family, school, and neighborhood also account for the increase in the risk for addiction. So, who is at risk? Individuals who use opioids for long-term management of chronic pain, or individuals who use heroin or misuse prescription pain relievers are at particular risk. Children and teens are at risk. Although taking drugs at any age can lead to addiction, research shows that the earlier people begin to use drugs, the more likely they are to develop serious problems. Therefore, extra care should be taken to protect kids from exposure to drugs and opioids. In addition to kids, adolescents are at particular risk. Adolescence is a developmental period during which the presence of risk factors such as peers who use drugs may lead to substance abuse. Some early signs of teen substance abuse include behavioral problems and poor grades in school, emotional distancing, isolation, depression, or fatigue, hostility, irritability, or change in the level of cooperation around the house, lying or increased evasiveness about after-school whereabouts, decrease in interest in personal appearance, physical changes such as bloodshot eyes and runny nose, frequent sore throats, and rapid weight loss, changes in mood, eating, or sleeping patterns, dizziness and memory problems, unusual odor on breath, widely dilated pupils even in bright light, or pinpoint pupils even in dim light, and many, many more. Devastating consequences of the opioid epidemic include the rising incidence of newborns experiencing withdrawal syndrome due to opioid use and misuse during pregnancy. Neonatal abstinence syndrome occurs when an infant becomes dependent on opioids or other drugs used by the mother during pregnancy. Symptoms experienced by the infant include tremor, diarrhea, fever, irritability, seizures, and difficulty feeding. So, how can you help? You can help by talking to your legislators and healthcare providers, by educating yourself and stepping out of your comfort zone, using your compassion. If you or a loved one is ready to seek help for addiction, find a physician or health professional who can help. And last but not least, Stand up for science. For further questions and information, please feel free to reach out to the Substance Abuse and Mental Health Services Administration using their national helpline.